Hello everyone, I am Dr. Fatima from CoreWorks Pune. Hope you all are doing well. Today I am here to tell you about the importance of physical activity during the recovery period of COVID and how to get back to routine. While you're recovering from COVID-19, you might face smaller battles every day until you get back to your normal life. Due to the damage caused by the virus to the lungs and other organs, the body takes time to recover. Physical activity will help shorten your recovery time, which means you can get back to a stronger, former state faster. But before I tell you why physical activity is an important part of recovery after COVID-19, I would like to explain it to you. A few complications which are associated with the same. First complication is pneumonia. Pneumonia is a lung infection in which the air sacs in your lungs are replaced with fluid or secretions. This reduces the lung capacity and oxygenation, leading to breathlessness. Second complication is diabetes. Post-COVID, the chances of increased glucose level is much higher in non-diabetic patients as well. This occurs when the pancreas produces less insulin or the body does not respond to insulin, leading to hyperglycemia or diabetes. Hyperglycemia facilitates the entry of virus into the cells, making it prone to further complications. The third complication is consolidation. This occurs when the air that usually fills the small airways in the lungs is replaced by fluid, secretions, or water. Benefits of physical activity. Physical activity improves oxygen saturation, breathlessness, and lung capacity. Moderate exercise like walking, which makes your heart beat a little faster and breathe a little harder. Your muscles will use more glucose, which is the sugar in your bloodstream. So, along with a good diet control, physical activity also lowers your blood sugar levels over time. Physical activity also strengthens your heart muscles. It allows it to pump a greater amount of blood with each heartbeat. This means that your heart works fewer times per minute than it would normally do. When your heart works less, it reduces the force on the arteries, thereby lowering the blood pressure. Returning to normalcy after coronavirus infection is a gradual process. You may have tested negative post-COVID infection, but symptoms may linger on for a while. Muscle fatigue, breathlessness, bone and joint pain are a few symptoms which takes time. The ideal way is to start slow. Now, depending on the symptoms, for people dealing with respiratory illnesses like pneumonia, the best thing is to start after a week or 10 days. Also, when you start, always start slow and keep monitoring your vitals, which includes respiratory rate, pulse rate, and oxygen saturation. And if you have any heart-related condition, then blood pressure as well. While doing any kind of exercise, if you feel uneasy or breathless, then you must stop the exercise immediately. For people having any kind of blood-related issues like thickening of the blood, it is recommended to move your body a bit throughout the day and start with the low-intensity exercise, which includes brisk walking. For people who have chronic cardiac conditions and who have recently been diagnosed with coronavirus, for them, the best thing is to take rest at least for 2 to 3 weeks before they start any form of exercise. Starting slow simply means involving in low intensity exercise and to do any kind of activity for 5 to 10 minutes in a day, at least for a week. This includes aerobic exercise and also activities of daily living. You can also begin with stretching and strengthening exercise, as these exercises will help minimize further physical deconditioning. Once you are able to carry out your activities of daily living without any difficulty, then you can gradually increase the intensity, time, and speed of the activity. You can also start with muscle strengthening. It is advisable to start with body weight training before getting into heavy weight lifting during the recovery from COVID-19. Also, make sure you do lung expansion exercises along with your physical activities. You can refer to our previous videos for the same. Progression may take longer for patients who have low baseline fitness or who demonstrate significant post-infection deconditioning. Kindly keep monitoring your respiratory rate, pulse rate, oxygen saturation pre and post exercise. Also, if there are any significant changes in the above mentioned vitals, kindly consult a nearby physician at the earliest. From Team CoreWorks, I strongly advise all of you to be active, stay motivated, and make fitness your priority. Thank you.